My name is Tanya Strange. I'm the Divisional Nurse for Primary Care of Ffrind Bevan Health Board. I'm the project lead for our Prescription for Loneliness initiative, also known as Ffrind.
The reality for our older people across Wales is that time is their enemy, but for different reasons. Not because there isn't enough, but because there almost seems to be too much of it.
Loneliness is a really big issue in our communities. It isn't written on your forehead that you're lonely, and it's not something that people can see, but it is something we need to do something about, and we can, and we must, and we will.
Because of the limited time that we have with our patients in appointments, and we haven't got enough time to counsel them thoroughly and properly enough, then we often end up over-medicating patients who are suffering with loneliness, or indeed treating it with drugs where that's not appropriate. If we could spend more time counselling them, or if we had services that we could refer patients to or signpost patients to, then that would be far better.
I think we've got to stop dishing out so many pills. I think we've got used to dealing with symptoms. So people come into whatever service because of an illness, whether that's physical or mental well-being issue, but those are symptoms of something else that's going on. What people are really struggling with are purpose in their lives and meaningful relationships. People need to feel needed. This is a public health issue, and now we've got the hard evidence to say we must do something about this.
My name is David Owen. I come to this service with 15 years as a volunteer with SAFA, and I'm now a volunteer with Ffrind. We established a partnership board under the leadership of the Ffrind Bevan University Health Board, which included the Gwent local authorities, SAFA, 1,000 Lives, NAPO, Coleg Gwent, South East Wales Academic Health Science Partnership, Age Cymru, Derwyn and Thrive Housing Associations, the Older Persons Commissioner's Office and GPs. We held an engagement event at which we had a very encouraging turnout, and we wanted to ask people what the effect was of loneliness. We asked 3 questions. How does loneliness and isolation affect people? How do people currently cope? And what needs to be done? At the same time, we held a competition to name the service, and this was called Ffrind. The feedback we had from this social event we have now used to move the service forward.
Hi, I'm Brian Morby. I'm an independent member with the Ffrind Bevan University Health Board. The outcomes from this project so far have been a good deal of intergenerational and multi-generational befriending, involving police cadets and students from Coleg Gwent. We've recruited lots of Ffrind volunteers, and they're going through a training program. As a consequence of all that activity, we're now finding actual events within the community which are demonstrating the value of the befriending exercises. So we've got nursing homes who now have nursery schools attending in order to have good relationships between young people and older people. You've got an established bilingual Scrabble club for lonely Welsh and English speakers, and this is what it's all about, really, trying to ensure that there is a coordinated approach to supporting those voluntary organisations which are part of the befriending process. Housing associations are now encouraging their tenants to befriend other vulnerable tenants, and we've started to recruit veterans who are now supporting other veterans. And I'm really pleased to say that lots of public sector staff within the Ffrind Bevan Board, but also elsewhere within the area, are volunteering. They've joined the Count Me In campaign and are supporting people who suffer from loneliness in our communities.
I think the key message is about the difference one person can make in the lives of somebody who is feeling lonely and isolated, but also by working together across organisations, across communities, we can actually make a huge difference to people's lives. So the message is about what one person can do to help somebody, but also what we could all do if we all just got together and did something really positive together.
Fundamentally, loneliness kills, and as a society we all have a moral duty to do something about it. Ffrind has created a social movement, one where partners and communities are coming together and taking positive action to combat loneliness across our communities. The fundamental lesson for us is that we must start asking people if they are lonely. This initiative aims to address the social determinants of health, and together we really can make a difference.